Thyroid hormone inactivation in gastrointestinal stromal tumors. Definition: gastrointestinal stromal tumors are the most common mesenchymal tumors of the gastrointestinal tract, representing the 1 and 3% of gastrointestinal malignancies. They are typically defined and the tumor host behavior is driven by mutation in the KIT gene and PDGFRD gene. His clinical features suggest compulsion hypothyroidism, which was confirmed by the expression of the thyroid hormone inactivation in CD3 in his research tumors. A video.
GI stromal tumors, or GIST tumors, are a relatively rare neoplasm or tumor that can grow in your body. They can exist anywhere from your eating tube or your esophagus all the way down to your rectum. The most common place that these tumors can be found are in the stomach. There are about 5,000 to 6,000 new cases of these GIST tumors in the United States per year. Some tumors are more malignant than others, but all of the tumors have some sort of malignant potential or the potential to spread.
I had one surgery 2 weeks ago. I had two tumors, basically, and one in my liver, and the one in my stomach, but in my stomach we found the cancer.
Talita ended up coming.
So continue. Signs and symptoms. GIST may present with trouble swallowing, gastrointestinal hemorrhage, or metastasis, mainly in the liver. Intestinal obstruction is rare due to the tumor's outward pattern of growth. Often this is historical of vague abdominal pain or discomfort, and the tumor has become very large by the time the diagnosis is made.
This patient is a 47-year-old male who presented with ulcer-like upper abdominal complaints. In the mid-antral region, an approximately 8 cm large oval smooth tumor is observed. There is clear ulceration on the top of the lesion, but no signs of recent hemorrhage. With the endoscope in the retroflexed position, a second larger ulcer can be observed. It is important to realize that such ulceration represents tumor necrosis and is no marker of malignant behavior. EUS-guided TrueCut biopsies proved this lesion to be a gastrointestinal stromal tumor. It was resected surgically. The second patient is a 60.
So continue. Pros. Monthly measure of serum thyroid in all patients with a large GIST burden and symptoms of hypothyroidism, even if tyrosine kinase inhibitors have never been used, could avoid the complication of occult hypothyroidism and the risk of incorrectly attributing hypothyroidism symptoms to the cancer or the chemotherapy. Another video.
Hi, I'm Joseph Kim, Associate Professor of Surgery at City of Hope. The physicians from City of Hope are here for several reasons. We want to be at the forefront of medicine, learning about the new studies that will change the practice of medicine. We're here to support our colleagues who are presenting studies that are being performed at City of Hope. And I'm also here at City of Hope to support my fellow who won a Concord Cancer Foundation traveling fellowship award. The biggest study that's been presented at ASCO in terms of my own practice is the use of Gleevec in the adjuvant setting. The study was presented today demonstrating that 3 years of adjuvant Gleevec was more effective than 1 year. So this is a practice-altering study that was presented today, and will surely be incorporated in the ways that we treat GIST tumors from here on out.
So continue. Cons. Potentially inactivate extracellular thyroid hormone, and this effect is sufficient to cause systematic hypothyroidism. Consumption hypothyroidism alone is sufficient to cause systemic hypothyroidism in GIST patients with a large load. Treatment data submitted in 2007 showed that treatment with imatinib sequence to surgeon sequence of GIST can significantly reduce the risk to the recurrence risk of the optimal duration of treatment are being tested during of treatment for 1, 2, and 3 years.